Hi, this is Dr. E again. I'm here today to discuss the preventive measure to prevent COVID-19. And this is a very important tool to protect all of us and save our lives, save our communities, save our nation from lockdown. It's a very simple measure. I'm just gonna go back and remind you what happened in the last recording. We discussed what went wrong, and we discussed there was a lot of, we didn't have PPE, personal protective equipment. Now we have more of those personal preventive equipment. So we need to utilize it, and we need to listen to the experts, and we need to listen to the medical experts and the public health, and to make a plan together and make the nation here in America and the Western Hemisphere all following similar measures so we can prevent another lockdown, and we can save more lives, and we can help each other and protect each other to stay safe, to make our country running, and to stop the chaos that happened last time. So the most important part of the prevention, which is the most important tool of controlling the disease. So the first important one, which is the golden rule in the medical field, is hand wash. You have to wash your hand with soap and water for at least 20 seconds, from 20 to 30 seconds. People think 20 seconds is not a lot. No, 20 or 30 seconds is a lot of time, and most of us, we don't do it for this much of a time. So it's important to do that. If we don't have this, or we're in rush or something, the hand sanitizer. The hand sanitizer has to have at least 60 to 70% alcohol. And this is the recommended one, and it has to cover the hand. The second most important tool is using of the face mask. We have different types of face masks. The one that use in the industrial type, which called N95. It's a very nice one. It's very good, but I recommend that we leave this for the people who work on the medical field and they need more protection, like dealing with COVID patients. So I'm gonna talk about the simple one. The simple one we have is the one like this. It's the very simple. It's made from paper, and it protects to good extent for us. It's very simple one. It's disposable, so it's supposed to be used for one time or one day, and then by the end of the day you have to throw it outside in the garbage, and you don't reuse it again. The simple way to use it is like this. You hold it from this tray, you put it in your nose and your mouth, you move it around your ears, you put it like this. You make sure you can breathe. And that's a very simple way of doing it, and it protects you. Protection here is two ways, you and the other side. If both of us will do it this way, we will limit the extent of infection at least 90%. If we use other tools, we can limit it more. And we use other protection and measures, will make it very difficult for the virus to pass all of those barriers. Does it stop the virus from going through? No. But a very limited amount can go through this and cause infection. And the infection and severity of the infection depend on how much of the virus load that loaded the airway. So that's an important measure. This is the way to take it out. You take it like this, put it like this, throw it in the garbage if you finish using it. So this is one of them. The second ones, they have like something like this, similar. It's not N95 because this one doesn't have the filter for N95. And same way, you put it like this, you take it like this, and it also helps you. This one actually can breathe easier with it. And it's also used in the industrial and the people who does some construction because it prevents the dust also. The fashionable ones, like this one, was in a wedding, as you see here. So it has really like the bride and the groom, and they have their initial. And it was really a very nice way from those people to help us to protect ourselves and protect them. And this wedding actually went very nicely, and I don't think people got infected from it. This is the similar one that I use from the clothes, which is like this. It's a little fashionable, and I put it like this. And when I finish, I take it like this. This one is washable. So you can take it and put it in the washing machine, and you put the detergent or other chlorine types of things and let it go and get washed. This is a very important measure on the prevention. And this is a very controversial issue here in the United States. Some people don't believe this will prevent. Nothing will prevent anything 100%. But it's better to be protected more than 50% or even 90% at certain times than not to be protected. And when we need to use those things. Number one, if I'm going out, if I'm going to a public place, if I'm going to be with other people, if I'm gonna be in a place where people over there cannot keep 6 feet, social distancing, like in a transportation, like in a bus, public bus or public subway or any kind of a train or even airplanes. So you have to use it, and you use it to protect yourself and the other people. Because I can say, oh, I don't care, I don't want to take it. Okay, but you have to do it because the other people has rights too. So it's a very important thing. And I believe we should not really have this discussion until now, because we saw that we have more than 15 or 17,000 people here in the United States died from COVID. And few million, also got infected. So we have a disaster, and we have economy that got affected, and we cannot afford another shutdown or lockdown of the economy and the businesses. We see the people and officials trying their best to control it, but it's like any viral disease. It will surge in the winter when the weather gets colder, the viruses gets more, they get more reproductive and they make more viruses, and there will be more cases. It's not something that we don't, it's expected, but we have to protect ourselves from getting it, or even if we get it, we'll get the very mild cases of it. So those two measures are very important. The social distancing, which is like 6 feet from each other in public places where it can be done, and try your best not to be in a very crowded places, and try to protect yourself and the other people by following those measures. When we go for schools, we have to do the same thing. When we go to pray or to our places of worship, we have to do the same things, because God actually asks all of us to take care of our lives and other people's lives. You don't cause harm to other people, and you don't want the other people to cause harm to you. It's a very important thing. And it's a very logic thing. So when people really objected and think will take our freedom, this will take our liberty, this will make us like slaves, I don't think all of those things is really important in the way that the benefit is much more than the risk. So when people lose life, it's a big, big loss. And we can prevent it. And the prevention is the best protection. So when we do that, we help each other to have a better life. At this moment, I'm just gonna, end up my talk here, because I will tell you this. COVID is not gonna disappear this year, and it's not gonna maybe disappear next year. And I don't think it will disappear. It might take a dive to become weaker, but it might become more stronger. The facts that we are already getting every day, it's not a simple virus. It's a very tricky one. It has a lot of modalities of resisting us from getting a safe vaccine, which is a very important. But I don't believe like in 2020 we will have a vaccine that's safe and effective and we can use it on a large scale. Same thing with the treatment. The treatment that was given to the president is a very good one, but is still in the early stage of experimental studies. So it was not really studied enough to be given in a commercial way. And the other treatment that we have, the other antiviral, also, it does not really, kill the virus completely. It just knock it down a little bit. It does not really make a big difference, and it's early to say if it will be good or not good, and we don't want to give anybody a false hope or any kind of hope that it's really like something will be available tomorrow like the antiviral for the flu, because it's completely different virus. This one is RNA. It has a lot of similarity with the HIV in the way it behaves, and it's very tricky. It changes its modality, and it's not easy to make vaccines or even treatment for it. So the treatment for this virus will be multi-antiviral. It's not going to be one. It will be similar to the HIV. One will help to stop the penetration. One will stop some of the enzymes. Some, will, destroy something inside it just to stop the replication of the virus. So it will be like more than one antiviral just to control this one. The new ones, which they are trying, the monoclonal and polyclonal, those are the big scientific things, and it's not easy for the simple people to understand it, even for medical people. But it's a very good way to think, but it's very early because we never tried before in the same way. So today I'm speaking about the prevention, which is our biggest weapon to prevent the virus from coming, because we are the people who will make the difference. And I will tell you this. People always think the doctors are the first line of the treating those, infection and viruses. No. The doctors and the EMS and all of us treating people after the fact that this thing came to them and already infected them and they're already sick. The first line are the preventive people who are from the public health, from the CDC, from all of those places where put our policies and give us a guidelines how to prevent it. Because if we prevent it, we're not going to need a ventilator. We're not going to need a lot of hospital beds. We're not going to need a lot of other things. So right now I spoke about our measures, how to prevent it. In the next video, which I'll make it short, we will talk about some supplements that might decrease the severity of the disease or might even make some people able to, not to get symptoms when they have it, or very mild symptoms when they get it. Because right now we have at least half of the people, they don't have symptoms. When I test people for the antibodies, a lot of people come with positive antibodies, never had any symptoms or know that they got exposed to somebody who had the disease. What makes them fight it and don't have symptoms? Right now we don't really know. It might be that they got exposed to different type of corona in the past. Maybe they have antibodies from something else. Maybe they have something in their body that we don't know. Maybe they taken supplements or some other stuff. We don't have enough information to give. But we see people, they did not have symptoms, and it's not few, it's at least half of the number of the people. So just for now, I don't want to make it, dark. It's actually much better than in the beginning from the early March of this year here in the United States. I think the second wave we will be able to fight it much better. We have better tools. We have people who understand that we need to do those things, and we have more positive attitude towards it, and we will win this battle as we did with everything before. Thank you very much. God bless you, and God bless America. And this is again Dr. E with me at the YouTube. Thank you. Bye.